On Life and Meaning is brought to you by Blumenthal Performing Arts, celebrating its 25th year presenting the best in the performing arts, sharing and employing the arts as a major catalyst to strengthen education, building community cohesiveness, and advancing economic growth. Further support is provided by Foundation for the Carolinas, inspiring philanthropy and empowering individuals to create a better community. And by the Arts and Science Council, Charlotte-Mecklenburg's resource hub and lead advocate for the regional cultural community, providing culture for all.
And so for me, what matters to me is continuing to be a good person, being a good dad, but also wrestling with these larger public policy issues that are impacting our country, and then trying to figure out, can I do both things? Can I play in that world of making a difference on a day-to-day basis for my family and my work and people I love, but also wrestle with these larger issues of how do we create a better, more loving country? And I haven't found that balance. I'm still, I wrestle with that often.
Don Jonas is Executive Director of Caring, which provides primary care to persons with modest means. He previously served as Executive Director of the Presbyterian Healthcare Foundation and as Senior Vice President of Community Philanthropy at Foundation for the Carolinas. Don has written extensively on public policy, including the aging of our labor force and the future of America's healthcare system. He is a recipient of the Charlotte Business Journal's 40 Under 40 Award. He is a German Marshall Fund Fellow, and he serves on a number of boards in the Charlotte region, including the University of North Carolina at Charlotte's Institute for Social Capital. In this episode, we explore community health, Medicaid transformation, choices in his life, the passing of time, and being the lead singer of a band. I'm Mark Paris, and this is On Life and Meaning. Don, welcome. What is Caring?
Caring is a health and wellness agency. We're a nonprofit. We've been here in Charlotte since the mid-1950s. We have a mission to help individuals establish and maintain good health.
And who does Caring serve?
We serve folks that don't have access to public or private insurance. So they don't have insurance from their employer. They're not eligible for Medicaid or other public assistance. They're, in all cases, very low income. And in most cases, they have multiple chronic diseases.
How many people are in need?
In Mecklenburg County, there are, depending on which economist or demographer you talk to, we're looking at 120 to 150,000 people that don't have access to public or private insurance. So we've got a county of 1 million people. 10-15% of those people do not have public or private insurance. It's even worse, actually, because there's a lot of studies that are out there on people that may have some form of insurance, but when you ask them in surveys, are you able to access care? About 250,000 people in Mecklenburg County, about 1 out of every 4 or 5 people say, I did not go see a doctor because of cost. I declined to take my family to get care because I couldn't afford it. Some folks sort of think the Affordable Care Act solved all problems, or we don't really need to wrestle with this issue. There are literally more than 100,000 people, our neighbors. I see them all over town. I'll go into restaurants with my Caring badge on. They'll say, oh, I've been to your clinic because my employer doesn't offer a care. Or another person will see me and say, oh, I've got a doctor and physicians reach out that you guys help us with.
Of the 250,000 people who are in need of this care, how many people are served by Caring?
Drop in the bucket. So we're able to collectively across our programs reach about 7,000 to 8,000 people a year. Now, we are part of a network of healthcare social safety net providers. It's a group called MedLink. So it has the federally qualified health centers. It has faith-based clinics. It has some free clinics. It has the sliding scale clinics that Atrium is a part of, and some of the clinic that Novant funds as well. Even in that group, this is everybody that's providing care, we're able to reach about 70 to 80,000 people a year. So all that to say, even the very best of intentions, when we're coordinated as best we possibly could be, we're still missing almost half additionally of the people that we ought to be serving.
What healthcare needs are your patients presenting?
Interestingly, at our clinic, we ask folks when they come to see us, what is your number one issue? We give them some choices. We also leave an open-ended question. Every time it's food. It's access to food. They've come to our clinic because there's something physically, a malady, something they need help with. But what that says to us is that the real challenge that people face is poverty. I mean, they come to us because they have a need that can't be addressed by our current dysfunctional system. But the real need is much deeper than just the healthcare ailment that they come to for us. Now, when they do get into the clinic, we find that more than half of the people that come to see us have multiple chronic diseases. So diabetes, obesity, hypertension, high blood pressure. We feel as a mission of our work is not just to be like a humanitarian urgent care. I mean, we do that. We're there. We're literally the only place in uptown Charlotte that anyone can come to see and we'll get care. But we don't want to just touch them one time, because if someone has a chronic disease, you really need to be seeing them repeatedly. And so we now have upwards of 1,000 people that come to our clinic in uptown Charlotte that are repeat customers. We are managing their care. We are their primary care home.
Don, you mentioned the clinic. In addition to the clinic, what else does CareRing do?
We also, about 7 or 8 years ago, we took over this program called Physicians Reach Out. Physicians Reach Out was a model that was actually started, it's gone around the country, this sort of collaborative network. It started in Buncombe County, and the Mecklenburg County Medical Society 12, 15 years ago, a number of docs went up the mountain and said, how is it that you're coordinating care from medical providers at no cost? And so we took this model here. The program got a little too big for the medical society to manage, so it came to CareRing. The idea is to provide a way for physicians to volunteer to care for the needy at no charge. It's one thing if one doctor raises his hand and says, yes, I'd love to have somebody come to my shop and I'll take care of them. But if you can get a critical mass of physicians that say, I want to be a part of this, you can do some really special things. And one of the things that's unique about Physicians Reach Out, it is the only place to access specialty care in Charlotte if you don't have public or private insurance. So what happens is in this consortia of providers in Mecklenburg County, if they find someone that probably has a specialty need, they will refer them to us. And so we have, again, half of the physicians in town, 1,600 physicians from all of the Atrium and Novant and Ortho Carolinas and the specialty practices. They've all agreed to see, in some cases, 1, in some cases 12 patients a year. And the results are pretty extraordinary. I mean, it was $33 million worth of donated care last year. Most importantly, the physical results, the outcome of our interventions are amazing. The way that we're able to care for folks. We just created, in the last year, a partnership with the Levine Cancer Institute. So it used to be in Charlotte, the cancer specialists were divided there were 10 or 15 different practices. Many of them merged into the Levine Cancer Institute. And once we were able to share our story of who we are and what we do, about a little over a year ago, the Levine Cancer Institute said, we will give you unlimited appointments. You know, our physicians now are not reimbursed based upon how much they provide. They have a set fee. And if you're already doing the behind-the-scenes orientation and screening to make sure this is a person that really doesn't have public or private insurance, send them to us. So I can tell you stories of, in the last year, 125 different charlatans who were walking around with a cancer diagnosis who now are receiving unlimited care at Levine Cancer Institute. It's extraordinary.
Don, you mentioned the low-cost clinic and Physicians Reach Out. But there is also yet another program that CareRing is involved in, the Nurse Family Partnership.
Yep. So Nurse Family Partnership is a evidence-based home visiting program. It has been around in the United States for over 40 years. The headquarters are out in Denver. Just about every state, 48 states, have Nurse Family Partnership programs in operation. The idea is to go into the homes of a low-income mom that's pregnant for the first time and to have a nurse, in our case at CareRing, that will go into that mom's home up to the 28th week of gestation and then will build a relationship with that mom so that she will stay with her through the birth of the child and until the little one is 2 years old. So over the course of that 2.5-year period, they will make upwards of 65 visits to the home. And it's a very rigorous evidence-based program that we have to have the right dosage of intervention across those 2.5 years. But if we maintain fidelity to the model, the outcomes are proven and they're extraordinary. So the little one that gets that intervention is much more likely to be born full term when they go in for birth. The mom is much more likely to either finish high school or to get into the workforce. And the little one finishes this really intensive program early in that child's life, 15 years later is much more likely to finish high school, to not be incarcerated, to get into the workforce. So it's a healthcare program. It's really a poverty-fighting program. And it's something that we know it works. There's no doubt about it works. It's expensive on the front end, but the return is really quite extraordinary to cost savings and lives changed and other things. So we're reaching about 300 moms a year right now. The need in Charlotte for a program like this, there's upwards of 2,000 moms a year that could benefit from this program. And so one of the things that energizes me and the board and the work that we're doing is how do we grow this program? Something I know it works. I know we can make a difference in people's lives. And we could make a difference in a whole population of folks who could utilize this, not just individual families whose lives are changed, but larger populations in need.
Don, how is Caring funded?
Caring is a United Way agency, and they've supported us for years and years and years. We line up very closely with their impact strategy, the work that we're doing. Large philanthropies support our work, Duke Endowment, Blue Cross Blue Shield, KP Reynolds, a number of large state charitable organizations help us. We receive some income from the people who come to see us. So in the clinic, again, we ask folks for a small contribution, and that adds up to a little bit of support. We raise money. We have a variety of different fundraisers throughout the year. So the state of North Carolina is a huge supporter of our work, including Mecklenburg County is also a big donor to primarily the Physicians Reach Out program, but increasingly the Nurse Family Partnership program too.
Do you have what you need?
No. In order to serve the people that we are reaching now, as long as we sustain the funding, yes, we can reach what we need. We have some visions and some plans. We're going through strategic planning process right now of how do we take this proven model of what we do, which is in the clinic, we put our hands on you and we make you better. In the Physicians Reach Out, we're like a switchboard network operator. We connect you to where you need to go for care. And Nurse Family Partnership, we go deep. We build long-term relationships. In each one of those three different approaches, there's an opportunity to grow. There's no question the need. Nurse Family Partnership, I've mentioned, there's thousands of moms that could benefit from it. In this county, there are tens of thousands of people that need access to care. And there's more than 100,000 people that don't have any access that need more clinics like ours. So we have enough money to do what we're doing right now, but for where we want to go and the impact we want to make, we need to raise more money.
Don, who is Maribel Connerat?
Maribel Connerat, yeah, she was our founder. She was a nurse in Mecklenburg County in the 1950s. She was sort of a social justice warrior in the 50s. She was like our own Mother Teresa here in town, she didn't think it was right in the 50s that there were hospitals that African Americans not only couldn't go to, they couldn't work in those hospitals. If you think about the disparities of care today, that are terrible in lots of different ways, and we can talk about it. But back then, it was extraordinarily disparate. I mean, you had no access to care for huge populations. And Maribel and a number of her friends, other nurses, would drive around town and they would knock on doors. She had a particular interest in women's heart health. That was really the very start of it. She was doing women's heart health, but it evolved to basically doing health screenings by a nurse who would drive her car with her friends and knock on doors on the west side and in Greer Heights and in places all over town. So she was very inspirational. I mean, that's the intellectual and the founder of who we are and why we do what we do was really Maribel and the work that she did back in the 50s.
In fact, you named an award after her.
We do, yeah. So we try to recognize folks in town that have a heart for community health and have given their professional time and wisdom to make a difference in community health. We've had folks like Dan Murray, who's been on your show, who we've been able to recognize. Arrington Mixon, who's a retired program officer from the Levine Foundation. One of my favorite years was when we had two winners, Dr. Ophelia Garman-Brown with Novant and Dr. Alicia Cole with Atrium. We jointly recognized them for their work around elevating the issue of community health and how we need to do a much better job in our community to address those needs.
Medicaid transformation is happening in North Carolina. What does that mean, and how will it impact the work of Caring?
Yeah, I wish I had the right answer for you now and I could explain to you what's going to happen. Medicaid transformation, North Carolina is one of the last states to go through this shift So generally, the state of North Carolina is moving into a Medicaid managed care environment. So in the past, if you were on Medicaid, the 2 million people approximately in North Carolina, if you're on Medicaid, you really had kind of unlimited services. You went into a Medicaid office and the provider would provide as much as you needed, a fee-for-service model. In this new Medicaid managed care, there is capitation on how much money is going to be spent within different regions of North Carolina. So there is a lot of interest from the hospital systems, from insurance companies, from a number of other providers to sort of get in on this business. How can we take the risk to provide care at a set amount to the Medicaid population? That's sort of generally what's going on. And that means a lot for us. It means directly for Caring, we don't currently process Medicaid. We don't process private insurance either. So we are going through a strategic planning process, and that's one of many things that we're looking at. Should we be a provider of Medicaid? I mean, the people that we serve, very low-income people, multiple chronic diseases, oftentimes English is a second language, it's very similar to the Medicaid population. So if we're able to get good results with the work we're doing, maybe we should be a Medicaid provider, not only because it would reach more people, but it could also be a revenue stream to assist us. The sort of counter argument to that is we have a unique model of care. We have a way where if you come into our clinic and you need care, there is nobody watching a clock to see how long we're spending time with you. There's nobody that says, wait, you don't have time to have your health coach and your care management person and your interpreter and the provider sit down for 45 minutes to fully understand you and your needs and how to connect you to care. Because we're not as familiar with it, there's some concern that that unique special sauce of what it is that we do and how we serve people could be fundamentally changed if we became a Medicaid provider. So there's advantages, but there's also some challenges if we shifted into that world.
Don, I've heard the term social determinants of health. What does that mean?
Social determinants of health are those factors that go far beyond the clinical needs of a population. So you think about an individual and where that individual lives and where they work and where they play and where they pray and all those things that people do. The social determinants are the factors that increasingly research is telling us has a much greater impact on one's physical long-term health. So most of the studies that are out there say that the clinical intervention is only really about 20% of what makes somebody healthy. It's a much larger impact around community connectivity. Do you have transportation? Do you have a job? What's your socioeconomic income? Do you have walkable streets? Do you have a park nearby you? There's these larger environmental factors that go far beyond just that clinical intervention that determine whether someone is healthy or not. And it's a much bigger issue for the folks that we serve because they are living in poverty. They're living in communities that don't have walkable streets. They're living in places where violence might be a higher rate than in other places. We have to be, and we are increasingly being much more cognizant of that when we're providing that excellent direct clinical care, that there's so much more that's going on in someone's life that determines whether they're healthy or not.
Is the idea of social determinants leading Caring in new directions?
It definitely is. It's starting for us to think about who we are and what we do and what our value is in the community. We're just reaching collectively 6,000 to 7,000 people a year with direct clinical care, but we are increasingly, we're seeing ourselves as this, and we're hearing it from others as well, that we're more of kind of a hub of connectivity. For example, we have formal memorandum of understanding with Crisis Assistance Ministry as an example. So when one of our nurses that's out in the community providing care through that Nurse Family Partnership Program, they may go into an apartment and there's no furniture, or there is dilapidated furniture, or it's clear that the family is at risk of losing power in their home or their domicile. We can go to the front of the line at the furniture bank that Crisis Assistance has to see to it that very quickly we resolve those tangible furniture needs that they have. That kind of a partnership is what we're realizing. When we're out providing direct care, we're increasingly seeing our value, being able to provide excellent clinical care, but being able to connect people to the broader needs that they have, whether it's housing or keeping the lights on or providing them access to food. We're talking right now with Second Harvest about why wouldn't we have a food pantry within the Children and Family Services Center building? That place has 10 different nonprofits collectively serving 40,000 people, many of them the same people across all these programs. Every one of us says that food is the number one issue that people have. let's put a food pantry right there. Let's make it easier on the person to address that. And that's sort of that core thinking that's happened over the last 5 or 10 years to go, you have to be great at your clinical outcomes in order to be providing healthcare. But to really make an impact on somebody's life, particularly somebody that's in poverty, you got to go so far beyond that. You got to start thinking about, even if it's not in your mission to do it, who in the community can provide those additional buttresses and supports to help that person get up and out of poverty.
Don, there is an effort underway called One Charlotte Health Initiative. What is that initiative?
So the One Charlotte Health Initiative came about after the unrest in Charlotte a few years ago. The leadership from Novant and Atrium and Mecklenburg County came together and said, why is it that we as individual institutions are not able to make a difference on community health? World class on cancer care and orthopedics and all these other things. And we have some clinics, we dabble in the clinics, but we're not really making a tangible long-term difference on community health in neighborhoods that have great need. And so this One Charlotte Health Initiative evolved out of those conversations. They are now looking at 6 neighborhoods where it's the highest poverty level in Charlotte. And between Mecklenburg County, Atrium, and Novant, they're saying, what can we do to make a difference to provide care in those communities? And there's some really interesting things that are starting to come out. There are mobile medical clinics that are going to be coming out online very soon. There are the Michael Jordan clinics you may have heard about through Novant. There is a mobile unit that Blue Cross Blue Shield is doing with it. There's lots of different activity, which is like totally awesome. My agency's been living in this space for 60 plus years. Of when are we going to get this community to recognize that there are neighborhoods and populations that we have ignored and have not provided care to? And we've been struggling and doing our very best. Finally, we have the 800-pound gorillas in town that have said, oh, we can't solve this individually, but collectively, we might be able to actually make a huge difference in our community. And so I'm incredibly excited about what this could be. I'm also extraordinarily fearful of what it might end up being if it's not coordinated appropriately. Because all these mobile medical units, for example, they're awesome. They're sexy. They've got branded on them. They go out. It sounds good, and funders love it as well. And it addresses a targeted population in a targeted neighborhood, but it needs to be coordinated across Mecklenburg County. Because I think where the One Charlotte Health Initiative could go, which is, I think in my grandest dreams and desires it would move in this direction, is that we have so many assets in Mecklenburg County. Most communities don't have what we have. 2 extraordinarily robust hospital systems, a network of healthcare providers within this community, which is incredible, through that MedLink group, us and many others. I can envision a county where there is 100% access to care. Anyone that lives within Mecklenburg County, undocumented, highest level C-suite executive, everyone could get access to care in their community. We could actually do that if we had the vision and the guts and the will to actually put something together. So I am incredibly excited about the hospitals and Mecklenburg County stepping into this world. I'm hopeful and I'm optimistic that it can move to something that could really be extraordinary for Mecklenburg County.
What would need to happen for that result to occur?
We have got to get all of the healthcare safety net together. It's easy for me to point fingers at the 2 hospital systems and say, thank goodness you're finally here. Well, I'm in this network of groups as well, and it's really hard if you're low income right now to know where to go. If you're low income and you don't have access to healthcare, currently people, mostly through word of mouth, kind of find our clinic. But it might be better if someone lived in Matthews and didn't have public or private insurance, so they went to the Matthews clinic. And it might be if somebody was living up north of town and they maybe didn't even realize they had Medicaid, they should be going to one of the federally qualified health centers. We currently, even within our system, are not as coordinated as well as we need to be. So I think a number of things need to happen. The healthcare safety net needs to say, we are one entity. We each have our own little pieces of what we do, but across Mecklenburg County, here's what we do and here's what we do well, and we can direct people much better than we currently are to get care. If you overlay that with the hospital systems and Mecklenburg County saying, we want to partner with you all as well. We want to help you to help provide way stations, telling people where to go to get access to care. You could actually do this. I think the most important thing you need is trust and communication and coordination across all these different entities to get there.
Do we need a healthcare czar?
We need a organizing structure. We need a leadership team that can authentically represent people in need and providers that have capabilities. I think that is one potential future for where caring could maybe provide its greatest role in this community. We know how to provide care. We know the other people that are providing care in this community. Through Physicians Reach Out, we've built a long-term relationship with all the major large healthcare systems. That's a place where, we don't want to raise our hand and say, we're the ones, we're the best, it's got to be us. What's interesting is starting to happen is that groups are coming to us to say, this community needs leadership. This community needs connectivity across the different providers. And I think that is a role that, again, as we're going through this strategic planning process, that's some place that we could step into.
Don, you've been executive director of Caring for almost 7 years. You've written, "It's been a thrilling run, mostly cheerful, sometimes heartbreaking, full of equal doses of optimism and anxiety." How so?
I came into this role not having ever run a nonprofit before. I knew about Caring and I knew about its value. I knew about its values, like how it does work and why it does work. I did not fully appreciate the challenge on a day-to-day basis of running a nonprofit organization. I didn't fully appreciate the challenge of sharing your story with donors to support the work that you're doing. I didn't fully appreciate things, but I'm not a clinician. And so I didn't fully appreciate the variety of different proven evidence-based interventions that come out of the clinical world. So I've had a really steep, fast learning curve to get to where we are now. I mean, Caring has grown. I came in and we had 20 employees and about a $2 million budget. We now have 50 employees I'm responsible for and a $4 million budget. I didn't fully appreciate when you're running a nonprofit, you're really running a business. I didn't understand fully appreciate initially just how challenging it could be to keep the train running on that mission, while at the same time tapping into this creative, passionate side of mine, which is to make a much bigger difference for the community. Beyond the immediate, keep it going, keep making a difference, how do we scale up and make a much bigger difference?
How do you feel about the work that you do?
I'm incredibly grateful to get to do this kind of work. Having grown up in Charlotte and done some writing on healthcare, gotten to know the nonprofit community, a lot of days I wake up and I can't believe I get to do this kind of work, where I'm really passionate about this kind of work, helping people that are on the margins and helping people that I feel I've been privileged in a lot of ways to get to where I am, and that I can tap into multiple sides of my personality to feel like I'm making a difference in the community. I'm having to be challenged intellectually with the work that we're doing, and that I can go home at night and feel like I know I've made a difference for 7,000 people, like tangibly that day have helped people feel better, have their health, have their wellness, have their ability to contribute back into society. That's it's a gift to be able to do that.
Don, you grew up in Charlotte. What was your childhood like?
I grew up in South Charlotte, right across the street from Selwyn, AG, and Myers Park. So in the Barclay Downs area. Growing up, my parents used to say there was a Barclay Ups and a Barclay Downs. We were in the Downs area, but to me it was idyllic childhood. This was back in the day in Charlotte in the 70s, where you could bike anywhere you wanted to. One of my very earliest memories was of the South Park area. So that was a cow pasture. I mean, that was a farm. So we were like right next to that area. And I could bike to the Barclay Downs Swim Club. I could bike to school. There were some creeks in the neighborhood that I spent a huge portion of my childhood climbing through and playing in. I was the third of 4 kids. I got kind of mixed up in the middle of that. A student at Selwyn and AG Myers Park, going there.
The Jonas family has deep roots in Charlotte.
That's right. My great-uncle, Charles Raper Jonas, was the U.S. congressman from this area. He was a Republican. He was I understand, the first Republican after Reconstruction in the South. He served 10 terms, 20 years, representing Charlotte. They kept gerrymandering his district, but he continued to represent the Charlotte area. So my grandfather was his brother. My grandfather worked at Johnson Mills here in town. What was great, the politics was great. Charles Raper, we could go up to D.C. and he could take us in the back alleys of the Capitol and other places. And so the politics was something that was kind of important to our family. And this idea of giving back and being part of the community was something that was important growing up.
And your mom and dad?
Mom grew up in Phoenix, Arizona. Dad was here in Charlotte, went to Old Central High School. He went to Carolina, and then Mom was working on a master's in theological studies at Boston University. My dad was at Harvard Law School, and they met playing bridge one night up in Boston and ended up getting married in Boston, and then moved back to Charlotte, and where my dad was, and he's still with us, but he's not practicing anymore, was a lawyer here in town. My mom did a variety of different things. She was a homemaker, and she was an excellent, wonderful mom, but she also got involved in the nonprofit community.
In fact, your mom worked for Habitat for Humanity for many years.
She did. Yep, she did. A couple things that were really influential for me. She also worked with Christ Assistance Ministry, right, when it was getting started. And there were Saturday mornings, I think they were at the old Dilworth United Methodist Church when I was growing up. That's where they kept their clothes, had their bank of items for families. She used to take me there on Saturdays to sort clothes when I was a little kid. And I still remember doing that. And for her, it was important for me to do that, to actually be a part of seeing what it's like for people in town that didn't have the same sort of privileges that we had. She was with Habitat for Humanity, which was really, she was very quiet about it, and I really didn't even know this was the case, but she was there with a number of the leadership team back in the late 70s, and it would have been into the early 80s now. At one of their events, there were a number of women that were sitting around a table, and they said, wouldn't it be great if we had a Habitat home that was built entirely by women? And it's hard to believe now in 2019 that there had never been a Habitat house built entirely by female construction workers and every trade you can think of to build a house. And it was my mom, a handful of women that thought about this. And it's now gone global, this whole idea of a women's build. There are thousands of them in places all over the world. And it started with my mom and a handful of people here in Charlotte, which is, again, she doesn't see herself as a visionary. And she doesn't, I almost shouldn't be telling the story, but it was instrumental to me to know that even someone like her, who was not looking for acclaim, but was looking for ways to do things better, had a little role in something that's gone global.
Your great-uncle was a congressman. Your dad was a Harvard-educated lawyer. Your mom studied theology and was active in nonprofit work. What was expected of you growing up?
So we were expected to make good grades. We were expected to be good kids. I did not have stern disciplinarian parents. They sort of set a standard, and it was an expectation that we would achieve that. I was a very engaged kid. I was the president of the AG student council. And then as I went to Myers Park, my grades were not the world's greatest grades of all time, but this was a different environment where someone that was a above average student could still get into a decent college. I went to UNC Chapel Hill. And so I think it was expected that we were going to do well, we were going to be good people, and that we were not going to embarrass our parents in any way. So fortunately, none of the stories of some of the things I actually did ever got to them.
Don, is there anything in your parents' career choices that was formative for you?
Yes. I mean, I look at my dad, who's the sweetest man I know. He was very civically involved through his career. So the Dowd Y, when it was built in the early 60s, when he had come back to Charlotte, he was the chair of the board at the Dowd Y, and he was very involved in our lives as Little League coach and basketball coach and other things. But his professional career was in law. And I've talked with him over the years where there was a time in his life before he went to law school that he thought about being a pastor. He thought about in the Methodist Church going that route. And I'm not sure what the decision-making was for him at the time, but he chose the law practice. And I think just as a child observing him, he was an incredible provider and mentor to me in many different ways. But I sensed he wasn't fulfilled. He wasn't happy with the work that he did, that he did it and he did it well, but he wasn't energized by the work that he did. And it's kind of sad to me now when I think back on it that there were so many different opportunities in his life with a person with his skills and his talents. Phi Beta Kappa at Carolina, he could have gone and done whatever he wanted, getting into Harvard Law School, extraordinarily bright individual. And he maybe didn't fully take advantage of other ways that he could give back. And I want to say this in a way that he's given back in countless ways. And again, he's an extraordinary father. But it did make me think, and over the years, as I was finishing at Carolina, not Phi Beta Kappa, but finishing at Carolina, what do I want to do next? And there was a time when I almost literally flipped a coin between apply for law school or kind of live into my passions. And at the time, my passions was around political science. I'd had an extraordinary teacher, Dick Richardson, that kind of got me energized and excited about how public policy is influenced through politics. And I made a choice at that point. I'm going to go the route of the life of the mind and academia and not go into law school. And I think in a lot of ways, maybe not as consciously then, but now thinking back, it may have been thinking about my dad and the choices that he had made that directed me into a slightly different way.
Don, you studied political science. Did you want to run for office?
I have always had a desire to give back in some sort of public service role. I have not had a specific office. I haven't ever had any ambitions nationally to do anything. I've always felt that at some point in my career, I'd want to be on the school board or city council or in some way feel like I'm giving to the community beyond just my own narrow personal self-interest. The political science degree was more around the intellectual fascination of political science. And at that time, I was particularly interested in state and local politics. I ended up going to Appalachian State University to get a master's degree up in Boone. And at that time, I was very interested in the environment. And I did some work on state-level opinions of the environment. To your question of whether I was going to see myself as a politician or in politics, I think at the very local level, making a real difference within a local community, I could see that. I think at the time it was more, I'd rather inform politics through more enlightened public policies.
Don, you went on to earn a Ph.D. in political science at the University of Kentucky. What was your dissertation?
I did a dissertation on state-level telecommunications networks. This was at a time when the information superhighway was just coming out and states were looking at a variety of different ways to harness digital technologies for education or criminal justice, healthcare, lots of different things. And I was familiar with the North Carolina Information Highway from when I was back in North Carolina. This was a privately built network that they were trying to grow across the state of North Carolina. I was also learning about the Iowa Communications Network. So these were two state-level networks that were held up as models. This is the way you should build a state-level telecommunications network. And yet they were diametrically opposed, from who owned the network to privacy issues to access to the content of the networks. And I just thought this would be an interesting study to figure out what is the best way for a geographic area, a state in this case, to build, own, and extend digital technologies out to the population. So I spent couple years in the Lexington Library, a lot of time in Des Moines, Iowa, much time back here in North Carolina talking with folks. I had former Governor Jim Martin spent an afternoon with me telling me about the work they've done in North Carolina on this. At the time, Terry Branstad, who's reemerged in politics, governor of Iowa, I spent some time with him to really understand it. I was trying to look at the leadership levels at the state. What is it about digital technologies that they want? How do they harness it? And how do they make a difference for their people?
With a Ph.D. in hand, did you consider an academic career?
So I always thought I would be an academic. I mean, that was the idea when I was in Lexington. I wanted to get a little liberal arts, bucolic, leafy college with a coffee maker and talk to 20 students about politics. That was the dream. That was really what I wanted to do, truly. And a couple things happened. Last year, when I had not finished my dissertation yet, I thought I'd just see what the job market would be like. So I sent out some vitas and resumes to a variety of different jobs that were posted in the Chronicle of Philanthropy. And one was a think tank that was based in Indianapolis. And they were, interestingly, hiring for someone that could help on a book on state-level telecommunications policy. And I was like, I got this. Like, I've spent the last 2 years in the Lexington Library. I'll give it a shot. I applied. I ended up getting that post. So I was a research fellow with Hudson Institute. I did help on a book on state-level telecommunications policy, but as I was there, they were also doing an upgrade to the book Workforce 2000. Workforce 2000 it's a rare think tank book. It became a bestseller, hundreds of thousands of copies. And it was getting closer to the year 2000, and Hudson said, let's do a rework. Let's do Workforce 2020. Let's look at globalization and technology and labor shifts, and how does that what does that mean for the American workforce out 20 more years? So I started to work on that. They asked me to work on that piece. And I found myself, while I was fascinated with the digital technologies piece, I was really more interested in human capital and in labor markets. And so I helped to write that book. That then, at the time, Hudson had a welfare policy center. This was when welfare reform was really popular. And at that time in Wisconsin, they were doing some really neat stuff around helping formerly incarcerated folks get into the workforce and moms get access to childcare and lots of other support systems. So I spent a year in Madison, Wisconsin, with a small group, about 3 or 4 others of us, consulting with the governor and the other leaders in Wisconsin around welfare reform. That then took us to Florida. We spent 2.5 years in Florida because at that time my wife, who had been trailing me across America on my professional career, got into a PA school in Barry University. And then we reversed course and went to Miami. And I ran the Southeast field office for Hudson, which the timing was really nice because the state of Florida wanted similar kinds of advice around their welfare and workforce systems. And if you know Florida, I think you're a Floridian, they do things differently there in a lot of different ways. Their welfare reform efforts were based out of Tampa, primarily because a very influential Hillsborough County commissioner said that's where it's going to be if they're going to have her lead it. And so my wife and I were living in Miami, and I was commuting back and forth to Tampa. But all to say, this was leading me in this path that had taken me far away from where I had done either my master's level work on the environment or my Ph.D. level work around digital technologies. I was getting deeper and deeper into human capital kinds of interest and things. That then led to the Robert Wood Johnson Foundation had heard about the Workforce 2020 book, and they said, hey, could you do a similar treatment on healthcare? And so I still remember the day this was still when we were in Indianapolis, I had a senior research fellow came into my office and said, we've got this opportunity. He asked me, so what do you know about healthcare? I said, I don't know anything about healthcare. And he said, I don't either, but we've got this major national group that says, we liked what you did with Workforce 2020. Could you do something similar with healthcare? And so that was really, which is interesting that I'm now sitting here talking about caring and the work that we're doing. That was just a chance thing. I happened to be there at that time and had shown some ability to digest trends and put it in a format that people could read that moved me into this healthcare space, which is where I've been now. That did lead to a book called Healthcare 2020 and Future Trends and Where We're Going as a Country, and doing a variety of different things with chambers of commerce around the country on both workforce and healthcare related issues. So it's just curious to me as I'm relating this back to you, how various things happen in your life that at least I didn't predict for myself. I didn't see that this is the path I would take to get to being at Caring today. But a lot of things happened along the way that there was a hand of God, or it was Adam Smith or somebody that kind of got me to where I am now.
How is it that you came to Charlotte and joined the Foundation for the Carolinas?
So I came back to Charlotte the day of my wife's graduation from Barry University. We had been planning to move back to Madison, Wisconsin, which we loved. She informed me the day of her graduation she was pregnant. So we had been trying to have children, hadn't had children, but suddenly she's pregnant. And my folks live here in Charlotte. Her folks live here in Charlotte. I've got a whole social network. So we said, let's go back to Charlotte. And I came back here, and I was running the Southeast field office for Hudson. Charlotte's in the Southeast, so I was going to open up shop here. At that point, though, I know I've got a child coming, and the work that I was doing with Hudson was taking me to Arizona and Boston and lots of other places. It's like, I'd really kind of like to get rooted here in the community. And I've heard this story from Michael Marsicano now that they did a national search for their person, and they just, on the side, they put a little paragraph in the Charlotte Observer classifieds. We're hiring for this person if you might be interested. And I saw that classified, and I sent my stuff in. And I think they thought, where did this guy come from? Because I had been working with foundations. I've been doing a lot of community building, spending a lot of time in the Mississippi Delta area. So at one point when I was with Hudson, I was spending like half of my week in the Mississippi Delta doing a lot of workforce development work, and the other half I was in Orlando. And these were two markets in America that couldn't be more different. I mean, the work that I was doing in Orlando was to help to find high school students to man the rides at Disney World. The work I was doing in the Mississippi Delta was, how do we find work? How do we find employers? Or how do we move labor to Memphis or to Tupelo or somewhere away in order to find work? Having immersed myself in community building in a lot of different environments, and having worked with foundations and having been a native Charlottean, I think a lot of that lined up well to be a fit for what the foundation was looking for.
You became vice president of community philanthropy.
That's right. And I inherited a incredibly generous gift to give back to Mecklenburg County. Lucille Giles, who had been a significant donor over the years, had left much of her estate to Foundation for the Carolinas, $25 million for the general benefit of the people of Mecklenburg County. So almost overnight, Foundation for the Carolinas went from being a place where donors and large endowments would park their money to suddenly having a voice in the community. And so we were able to put together strategies around how do you invest $25 million to improve the general welfare of Mecklenburg County. And at the time, the United Way was very effective in dealing with a variety of different human needs. The Arts and Science Council was effective in a lot of different ways in the arts sector. But there were three areas that really needed help. One was around the environment, and I had a little background on that. The other was this out-of-school time programming. And the third was around social capital, this idea of building trust across differences. So the work that I did at Foundation for the Carolinas was to establish grant-making priorities on those three different areas.
Don, Joe Martin was someone important to you. Who was Joe Martin?
I got to know Joe, former Bank of America executive, through Joe's son, Joe B. Joe B. and I got to be friends. 5th grade, I think it was, my parents, we shifted from Little Mouzon Methodist Church to Covenant Presbyterian Church, and Joe and his family had been there, and Joe B. and I got to be very good friends. In fact, he officiated our wedding, and he's now back in Charlotte. But I got to know his dad, and I became sort of fascinated with his dad. His dad was a Ph.D., I think, in English literature, and he had done some work with Queen's University, I think on the fundraising side. And at the point where I got to know him, he was kind of the conscience of Bank of America. And I thought, wow, what an incredible life that he's gotten to that point in his career, and it's been so diverse that he's been able to have this wonderful family, but he's also been able to make an impact in the Charlotte community. And I thought then, and I still think it today, gosh, I'd like to be Joe Martin. I'd like to have his intellect. I'd like to have his passion. And he was a member of the Charlotte School Board for a few years. He was way ahead of his time on thinking about how do you build diverse schools, successful schools, and how do you build successful communities? And so even to this day, there are times where I think, what would Joe Martin do? How would Joe respond to a healthcare issue that I have that may arise on any given day?
Don, after serving as Vice President of Community Philanthropy at the Foundation for the Carolinas, you became Executive Director of the Presbyterian Hospital Foundation during the Great Recession. What did you learn about yourself during those years?
Yeah, I was recruited over to the Presbyterian Hospital Foundation to be their executive director. They had a foundation, but most of it was funds that were designated for nursing scholarships. They really weren't active out into the community. And I knew when I was at Foundation of the Carolinas, I loved the work that I was doing, but most of it was just on the grant side, which is awesome. I was helping to figure out how to invest millions of dollars in the community. But I wasn't on the board governance side. I wasn't around raising money. I wasn't around managing a board. And I knew at some point in my career I wanted to try that. And that's when a recruiter came, and it was something that was local. And I thought, I'll give this a shot. This should be fun. And in many ways, I learned a lot about myself and my strengths and my desires. I mean, one of the things I figured out relatively soon was that the Presbyterian Hospital Foundation was almost entirely a fundraising operation. There were definitely impacts out in the community, and I really leaned into those sort of opportunities. One which was particularly interesting for me, when I was at Foundation for the Carolinas, we had helped on this Crossroads Charlotte initiative, which was imagining 4 different futures for Charlotte. And then it was engaging institutions to, within their mission, try to make a difference to maximize the likelihood that Charlotte would move to a more positive future, mostly around social capital kinds of issues. And soon after I left the foundation, and then when I joined Presbyterian had raised its hand and said, we'd like to be one of those institutions that looks at something that I helped to design when I was at Foundation for the Carolinas. And so one of the things that Presbyterian realized is that they were not effectively getting care out to underserved children in the community. And so I was able to help them with a mobile medical unit, which is the Community Care Cruiser, which came through funds from the Duke Endowment and many others in town, and coordinating with houses of worship to take a mobile unit to serve And at that time, there were thousands of children that were not getting access to care. So I was able to live into those sorts of passions, but I also came to learn when I'm purely just trying to raise money, that's probably not the best fit for me. Like I can see a vision and I understand, or I'm learning how to tell stories about how to get donors to give to the work that you do. But when that's the only thing that I'm doing, it may not be the world's greatest fit.
In June 2012, you became executive director of Caring. How did that come about?
I had been doing some consulting in town. People that had known me over the years, Kelly Chopas and Jay Everett and others. I was helping on some corporate philanthropy initiatives they had in town, some really impactful work. One was with Veterans Reentry program that was going on that I did some project management for them. There's a huge number of veterans that come back into the Charlotte market and they need access to education and healthcare and a lot of different things. And I helped to lead that work. It was interesting work and I was enjoying it, and it probably could have been financially lucrative if I had continued to do that work. And yet I was feeling alone. I was sort of like a consultant that would every now and then participate in a conference call, and then when the phone would click off, I was there by myself again. And I felt like I needed to be part of a team. I knew that there were gaps in my ability that I was never going to fulfill. I wasn't a lawyer. I wasn't a finance person. I needed to be part of a team that was doing something bigger. And I was recruited to Caring. I think Dr. Hayes Woolen, who's with the Novant system, had known me, and I've known their families forever. And I recall one day he called me and he said, "Don, I think there's this group in town that lines up really nicely with you and your interests, and you ought to talk to them." And I did talk to them, and it's led to me being there now for close to 7 years.
Don, you are the lead singer of a band. Who are the Fidgets?
The Fidgets are a group of knucklehead freshmen in Carolina in 1985 or 86 that decided to form a rock band. So the Fidgets started out as the Wax Image. We were a cover band in Chapel Hill. And gosh, I still remember learning the lyrics to Driver 8 for REM, or at the time we were playing a lot of, and we still do actually, a lot of REM and U2 and the Replacements and other sort of alt-rock groups that were coming out at that time. And it ended up, the Fidgets have now been together for 30 plus years. What's been beautiful about the Fidgets is that I just got lucky. I got a group of guys that are good people that happen to be super talented musicians to come together and to play music. So over the years, the Fidgets, after college, we broke off. One went to law school, one was in business. Our drummer is extraordinary. He went to the New School up in New York, and he's just super duper talented. We split off, but then over the last 10 or 15 years, we've all moved back to North Carolina. We're all over the state, so it's really hard to practice. We've got one guy in Matthews, I'm here in Charlotte, Greensboro, Winston-Salem, Raleigh. We get together in Greensboro, which is sort of the midpoint. We try to do it more often, about once a month, and we make a racket in his garage. You know, a lot of guys play golf. I used to, can't really afford it. I'm not good at it. Or they play cards. I get together with friends for 30 years and we play REM songs. And we create new music. I think that's one of the things I wish I could have done more. I wish they were all here in Charlotte because I have so many songs in my head. I write them down. I write down ideas, and I've taken to starting to record melodies that I'm hearing. I wish we had more space. I wish we had more time to create music, to create songs. For a lot of different reasons. I mean, you play I Want to Hold Your Hand 7,000 times. You want to play some new music. But we're really good at it, and we really enjoy it, and we play for friends and parties and charitable events when we can. But I really would like to grab some of these songs that I know that are out there that I want to tell stories about, and we just don't have the connectivity or the time to do it.
How's your voice?
So I would consider myself a pedestrian singer who sings in the shower, who enjoys singing, has sung in church, and has had some experience singing in front of people. I don't see myself as a rock guy or a lead frontman kind of person, but I do get a real energy and electricity courses through me when the guys get together and we flip on the amp and the guy hits the drums and we start to play. It's like, man, it brings me right back to 1985 at Stacy Dorm, thinking up, cover songs that we could play. It really has been a very important creative outlet, but like real outlet for me and who I am being in that band.
Why is the band called The Fidgets?
Again, we were the Wax Image initially. We didn't like that name, and we went through lots of different potential names. I think part of it is that I am a fidgeter. I can't keep my hands still. I've always been a little kinetic in my movements as a lead singer for a band. And it just seemed like it sort of fit for us. We were, again, a mid-'80s cover band, was playing alt-rock kind of songs. It seemed like a nice fit for us.
There is an original song you sing called Smoke Rings with these lyrics. How do old folks make friends? How do angels dance on pins? What does that lyric mean to you?
That's interesting. That lyric, if there is any kind of thread between all of the songs that we've written or that I've written that we perform, and we've got 20 or 30 different originals over the years we've written, it's really about loneliness. It's really about being lonely today in our own bodies, in our own life right now, and how do you make friends now? And then almost a fear and anxiety of, it's challenging to be lonely now. Gosh, what would it be like if you're an older person who's not as mobile and doesn't have the social network, if they're then lonely, and how devastating that could be. So it's really, now that you've asked me, I hadn't really thought about it. It's sad, but I think it's real about thinking about people in different stages of their life. How do they address loneliness?
There is also a song you wrote and sing called Make Time. Do you sense time passing?
Yeah, totally. Yeah, I really do. I have hit the 50-plus mark in the last little bit, and I've started, for the first time in my life, I've seen the runway. Like, I've just been doing stuff, and changes have come, and I've adapted and moved on. And this is really the first time in my life where I'm like, gosh, I'm running out of productive time or creative time or me time to, like, there's only so many more years that I have to give to make a difference for my family or professionally or in my community. And I just never thought that way before. I didn't have that mentality. I just sort of rolled with each day. And I'm just becoming much, 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 much more aware of how priceless time is.
Don, what matters most to you?
I have some priorities that I've had since I was a little kid, which is around family, around being a really good dad, around making a difference in the community where I live. And I try to do the best that I can in all those things. I think what also matters to me is feeling like I am making a larger difference in our community and in our nation, if not our world, if I could be so bold. That what matters to me is finding that balance between doing those things, those humdrum day-to-day things of being there for my kids and for my wife and for my friends and for my parents and for my employees, but also balancing that with a desire to make this much bigger impact in this world, whether it's through singing songs for the Fidgets or it's making a difference on the way we provide healthcare in this community and in this country. That really eats at me that we have models, we have ways to provide healthcare that work in advanced democracies around the world that cost less and get better outcomes, and we have decided not to do that in our country. And that matters to me. It bothers me. It hurts me to think that there are evidence-based, proven public policies that we can make healthcare better in this country, and we don't do it. And so for me, what matters to me is continuing to be a good person, being a good dad, but also wrestling with these larger public policy issues that are impacting our country, and then trying to figure out, can I do both things? Can I play in that world of making a difference on a day-to-day basis for my family and my work and people I love, but also wrestle with these larger issues of how do we create a better, more loving country? And I haven't found that balance. I'm still, I wrestle with that often.
Thank you for your time today, Don.
It was a pleasure. Thank you, Mark.
Don Jonas is Executive Director of Caring. Don received a bachelor's degree from the University of North Carolina at Chapel Hill, a master's degree from Appalachian State University, and a Ph.D. from the University of Kentucky, all in political science. And now, a personal word. There is a show on Netflix called Black Mirror. Imagine if Rod Serling produced a series in the 21st century. Black Mirror is a cross between Twilight Zone and dark dystopian novels you'd order on the internet today. Black Mirror describes itself as sharp, suspenseful tales that explore techno-paranoia and collective unease about the modern world. In the first 4 seasons of the show, Black Mirror has explored memory implants that record everything we see and do, a new service that lets people stay in touch with the deceased, a world in which social standing is determined by strangers voting each other up or down on their phones, a dating program that puts an expiration date on all relationships, and soldiers returning home from war with strange technical glitches. My favorite episodes are Archangel, about a worried mom who signs up for a device that monitors her daughter's whereabouts, and San Junipero, about a shy young woman who bonds with an outgoing party girl across space and time. The episodes are disturbing, mind-bending, fraught with warning, and irresistible to watch. What does Black Mirror have to do with Don Jonas and community health? There are so many answers to that question. Here's one. Season 5 of Black Mirror begins with an interactive movie called Black Mirror Bandersnatch. Set in 1984, the film follows Stefan, a young programmer who begins to question reality as he adapts a sprawling fantasy novel into a video game. The movie prompts the viewer at multiple points throughout the film to select one of 2 choices on their computer or television screen that affect what happens next. It is a choose-your-adventure story. The film has hundreds of paths and many distinct endings. Within each path, there are references to other paths and to decisions made and not made. Stefan senses that he is not in control of his choices, as the viewer on Netflix is making key decisions for him. The illusion of free choice is disrupted in the storyline as we watch the film in suspended disbelief and participate as an actor in the narrative. Why the name Bandersnatch? Layers upon layers here as well. The Bandersnatch is a fictional creature from Lewis Carroll's 1872 novel, Through the Looking Glass. Carroll writes, "Beware the Jabberwock, my son, the jaws that bite, the claws that catch. Beware the Jubjub bird, and shun the frumious Bandersnatch." Elisa Wilkinson in Vox magazine explains the connection between Lewis Carroll and Black Mirror. Wilkinson writes, 2 years after the publication of Through the Looking Glass, Lewis began writing a standalone poem entitled The Hunting of the Snark, an Agony in 8 Fits, which borrowed words, ideas, and characters from the world of Alice, including the Bandersnatch. In the poem, a group of adventurers encounters the Bandersnatch, which has a long neck and snapping, frumious jaws. That's all Carroll says about the Bandersnatch, but something about the sneaking, ferocious, fast-moving creature has captured the imaginations of writers, artists, and musicians in the century and a half since, as have many other elements of the Alice mythology. You can find references to Bandersnatches in science fiction and detective novels, in TV shows and video games, in comics and music, and more. So it's easy to see why Black Mirror Bandersnatch, the story of a young man whose obsession with his work makes it possible for the work to turn around and bite him with its own frumious jaws, would explicitly make the reference. In Black Mirror Bandersnatch, Stefan goes headfirst through a mirror into a previous time in his life. He goes through a looking glass into a different timeline. Don Jonas referenced different decision points and lives he might have led. He could have gone to law school. He studied political science in graduate school instead. He could have become an academic. He went into public policy work instead. He could have moved to Wisconsin. He returned to Charlotte instead. He could have remained a private consultant. He became an executive director of a community health center instead. He could focus on delivering core services within a limited budget. He is working toward an ambitious, comprehensive solution of community health needs instead. Don senses time passing. The past becomes immutable, unless it isn't. Like Don and Stefan, we make our choices. Our decisions are influenced. There are forces guiding us. There is culture that shapes what we value. There is always context. There is always the life we lead and lives that go unled. There is what if and what might have been. Our path is a labyrinth. We live in a multiverse. The same is true about community health, but to an exponential degree. Millions of citizens are making decisions, all influencing each other, all leading to a myriad of outcomes. A day in the city is an infinite number of divergent story paths and parallel realities. There is a choice we have at the bottom of the screen. Yes, to coming to terms with the choices we have made, knowing there is only so much we controlled, or no to the life we have led and living in regret. The frumious jaws of the Bandersnatch await. This is Mark Paris, and you've been listening to On Life and Meaning. Additional support for this podcast is provided by the UNC College of Arts and Architecture, celebrating a decade of creative education in the arts and design. Thank you to our funding partners, and to my teammates, Andy Go, producer of the show, and to Chris Curriton, art and media director. This is how you can help. Please write a review on iTunes. It helps us grow our audience. Follow us on Facebook and Twitter. We'd love to hear what you think about the show. And become a patron. We are on Patreon, a crowdsourcing platform that allows you to support what you value at a level you choose. Visit us also on our website, onlifeandmeaning.com. Thank you for listening.